And we will get right into our first speakers of the day. We have a tag team that I think you're going to quite enjoy to start our Tuesday morning. We've got Karen Brown. Karen serves as Vice President of Marketing and Communications for ChristianaCare. It's Delaware's largest health system. Karen motivates and inspires an energized team of more than 30 bold strategic thinkers as she leads the health system's strategic communications, brand management, and marketing functions. A visionary leader with a passion for engaging communications, Karen brings a depth and breadth of experience of the development of robust marketing communication strategies. We're interested in hearing more about that. People who know Craig Fairfield often describe him as a people person, and they're right. Whether mentoring or guiding account service teams, developing compelling strategies, or teaching college freshmen the principles of marketing, perhaps your most challenging thing, he always takes a people-first approach. His 20-plus years of experience have taught him the value of putting himself in the shoes of others and thinking critically about their motivations and desires. As always, you can see their speaking bios and everyone else's speaking bios in the mobile app. But for now, without further ado, let's welcome up to the stage our team of Karen and Craig. You're going to do wonderful.
Oh, we got the love train going. Yeah. You guys want to get up and dance to the love train? Yeah? I see a couple people who might dance. I like it. That's a good choice.
Love it.
Karen's entry music is Love Train for a lot of the stuff that she does talking about this brand. And you'll understand why in a minute. You may be wondering why we're talking about branding at all this morning and at all at this conference, right? It's about human understanding and storytelling and taking good care of our patients. I'd like to challenge you for the next few minutes to think about your brand as the ultimate foundational storyteller. So what your brand is saying to the world facilitates all those other things. And if you don't think your brand is saying anything to the world, you're wrong, because it is. Every brand says something to the world, so you need to make sure that yours is aligned with your organization. We've had some great stories over the past couple of days. Manny's story was fantastic. We had e-patient Dave telling his compelling personal story. We learned about Nordstrom and how they approach customer service. And last night, I guess most of you guys were here last night when Sekou did his thing. I really wanted to rework our whole program and turn it into spoken word poetry.
A love poem. We stayed up all night to try to make it happen.
Yeah.
There's no way.
A love affair with healthcare was his thing, which is fantastic. But I knew mine would end up more like Dr. Seuss than Dr. Dre. So I thought I'd better skip it. We do want to tell you guys a story this morning, though. Are you ready for a story? Karen, are you ready to help me tell this story?
I sure am. Is it a love story?
Well, not exactly, but there is a lot of passion in it. There aren't any star-crossed teenagers on sinking ships, and there aren't any pirates to be fought or family drama. But there is drama.
Princesses kissing frogs.
No, I'm sorry. No princesses kissing frogs. But there is a transformation element to this story, too.
How about knights in shining armor?
That would be cool. I should have thought of that, but there aren't any knights in shining armor in here. The heroes of this story are the 14,000 men and women of ChristianaCare who bravely take care of the people in your community, right?
That's right, Craig. And you know what? We fondly call those caregivers for a reason. Every single person in our organization is called a caregiver. Whether you're at the bedside or not, you are a caregiver in our organization.
It's a great way to think about it. So it's not a love story in that way, but it is a story about love. And it does have a happy ending, like all the best stories about love, right? But we're getting ahead of ourselves a little bit. Let's take a step back to the beginning of this story, and it starts in a place called Delaware. Raise your hand if you've heard of Delaware. Raise your hand. Keep your hand up if you could find it on a map. We either have a lot of people who are way better than average at geography or a lot of people who don't mind lying first thing in the morning. Tell us about Delaware. Where is it?
That's right. Delaware is a small but mighty state, situated just halfway between New York City and Washington, D.C. We're just about 30 minutes south from Philadelphia, Pennsylvania.
There's no shortage of healthcare in that corridor, right? From New York to Philadelphia, down to Baltimore, down to D.C. Lots of great systems and lots of great choices. Fortunately for you guys, ChristianaCare is one of those fantastic systems. Look at all this swag, right?
Absolutely, Craig. We are tremendously proud of all of our accomplishments. We are honored for our excellence and quality care We're also recognized repeatedly for our innovation in technology. Super, super proud.
Yeah, diversity, magnet, all the right things here. It seems like a really special place. But
it is.
A few years ago, you realized that maybe the brand hadn't kept up with the organization, right? It was such a special place. It had grown and evolved and changed so quickly that you realized maybe the brand hadn't kept up with it. This was the previous brand from a few years ago, brand Mark.
Oh my goodness, yes. So this was who we were from the 80s all the way to 2019. And you know what? The organization was evolving so rapidly. We were changing and growing in so many different ways. We really were becoming not a healthcare system, but a system that really impacted people's health. And so we knew this didn't feel right, but we weren't exactly sure what. We just knew we needed to think about a refresh. We didn't think the brand was really working for us any longer.
The brand had a couple of funny nicknames too that you can ask Karen about later.
Oh my God.
Anytime a brand is around for very long, or maybe a little too long, people start to shortcut it. Do you want to share any of that?
That's right. So I have to ask, how many people here see a C for ChristianaCare? Right? Okay, I see some great hands. That's great. How many people see a claw?
A big scary robot claw.
I see hands too. How many people see a wrench? Oh, some folks as well. And how many people see the sideways embrace? Because that's what it really is. Oh, I don't see many hands up at all for that. So as you can tell, we really were like, oh my gosh, who are we? What are we? Maybe it's time to refresh.
But you didn't know what to do next,
right?
You
did not know what to do.
Let's take a minute here and talk about brand. This is a brand mark in the name of an organization. There's way more to branding than just a mark. And when I talk to people about brands, they often start by saying, oh, we have a brand. It's the dancing figure and our color's blue and yellow, right? That's not a brand. Let's play a little game about brands. First of all, these are all familiar brand marks, right? Hopefully they evoke some sort of feeling or understanding for you guys. I can't not see the arrow in the FedEx logo anymore now that somebody pointed it out, right? FedEx is about moving things from one place to another. So good brand marks and good brands make those kinds of connections. They have to be authentic, and hopefully they make some sort of an emotional connection too, and they really make sense for your organization. So let's play a quick game. I'm going to put one word at a time up on this screen, and I want you to shout out the brand that you think that I'm talking about. And I have a special prize for whoever gets it first. So when I say family, what does that make you think of? Is there a brand that comes to mind? Johnson & Johnson, somebody said? Nope, that's not it. Disney. Wow, I'm going to have a lot more prizes because that's exactly it, right? Disney's about family and fun. It's also about fantasy. It's about giving people an escape from reality, right? We all know what Disney does. What does Disney do? Cruise lines. I live in Miami. We see the Disney cruise ships coming in and out all the time. Movies, music, theme parks, all kinds of stuff. But it's all arranged around the idea of entertainment and really escapism too, right? And in case you guys weren't quick enough to get to Disney, I had this slide to give it away. So we know what Disney is, and we know in our hearts and in our brains why Disney is, right? Disney exists to let us escape from our regular lives for a little while. That's Disney's why. We had to figure out ChristianaCare's why. We had to get to the essence of why they exist, why they get up in the morning, why they do what they do. We had to chart a course for that, though. You don't get to a big answer like that accidentally. So we knew we needed to do some research. We needed to do some strategy. We needed to make some things, get them out there in the market in a powerful way. And then we needed to see what happened after that and see if we were on the right track and adjust accordingly. There was a lot of work to do, right?
There sure was. And you know what? We could not have picked better partners than our partners at Wax Communications. They worked with us for over 18 months to do research and to bring this all together. And we reached approximately 1,450 people in a 4-state area, Pennsylvania, Delaware, Maryland, and New Jersey. And we asked them tons and tons of questions about Christiana's brand equity, our brand preference, and brand awareness. We did very intimate one-on-one interviews with all of our board members, with all of our leadership team, very intimate conversations, really probing at people what they thought about when they thought about ChristianaCare. We also did focus groups, 90-minute focus groups. We included physicians and nurses. We included employees from all walks of our organization and all parts of the organization. We included community members and the public as well. We also did online and phone surveys as well. Every single caregiver was sent a survey to take. We also did that on our website. We got great intel on what people thought about ChristianaCare.
Don't assume anything. Assume nothing really is the best advice I can give you. Get out there and ask people. You might think that your brand stands for something, and you might think that people think of you in a certain way, but until you really get out there and ask them, you can't possibly know. And that's really the most critical thing. It's the perception of what you stand for. We also did one of my very favorite things, which we call Man on the Street, and that's where myself or someone else from the organization just takes a microphone and a person with a camera, and we literally walk around a neighborhood, walk around a service area, and just ask people. We don't tell them why we're asking them. We just walk up to people and say, hey, we're talking about hospitals today. Tell me a few hospitals around here. And they either come in and they're like, oh yeah, let's talk all day about hospitals, or they run the other way. But either way, you can dig in a little bit. You can get some really interesting answers. We thought you guys might like to see a minute of some of the results from the Man on the Street that we did.
When you think of ChristianaCare, what are the first 3 words that come to mind?
Efficiency, attentiveness, a clean environment.
How would you describe the difference between ChristianaCare and other hospitals, whether they're better or worse?
I know that Christiana is a bigger facility, and or at least I think it's a bigger facility, and I don't know, I would prefer to go to Christiana now that I'm in Delaware too, and it's closer.
Mary, what hospitals do you use?
Normally Bay Health.
ChristianaCare.
Is it fair to say that ChristianaCare, the name, resonates with you?
Definitely.
Have you heard of ChristianaCare?
Actually, I haven't.
You haven't heard of that?
No.
It's a name that's always around. You see their signs everywhere. I mean, I think it's like the hospital to go to for Delaware. I live in Newark, but my favorite hospital is Union because I just feel like it's not as big and has more personalized service. The wait times are down.
We did hours of these and culled these down. I love the young woman toward the beginning who says, I know they're big. Well, at least I think they're big, right? She was really certain, and then she wasn't certain. And that's pretty typical, right?
Absolutely. We had such great fun doing those Man on the Street interviews. And I'm happy to report we only got thrown out of one place.
That's a pretty good record. Only one. I've been thrown out of a lot of places doing this.
You know, and it was Cowtown Rodeo in Woodstown, New Jersey. But it was all good. We ended up paying $40 and we got a little table at the farmer's market and we had a wonderful day there, but it was really great. And I will tell you, it's great. We also listen to this input because right soon after this, guess what? ChristianaCare acquired Union Hospital that the young woman spoke about at the end. So that was in the works already, but super proud that we were able to make that acquisition.
What did we learn from all of this research? Oh my goodness,
Craig, thanks. We learned so much from all of this input, such rich input. We had an opportunity to really probe what people thought. And what they told us was that the logo that we all just saw was really tired and old, didn't really stand for much of anything that everybody could agree to. And when we asked 3 words that came to mind when they thought about ChristianaCare, there was no consistency whatsoever. The words were all over the place. They knew we were big and people trusted us, especially in Delaware, so we knew we had brand equity. The town around our main hospital is called Christiana. We also have a Christiana Mall nearby us, which is tax-free shopping in Delaware and draws people from all over the area. So we knew we had brand equity in the name ChristianaCare. People knew that we were big, but they didn't know exactly what we did. It was kind of vague. They weren't really sure. And what we also learned was that when it came time to think about the engaging with the community, they could recall all of the Philadelphia commercials. They could tell us all that was happening there, but they didn't see ChristianaCare out and about in the community, and they certainly didn't think that we advertised enough. So it was all really, really great info.
And it was interesting. Nobody had anything bad to say about ChristianaCare. They mostly just weren't sure what you stood for and everything that you did, and they thought you were big, but then they thought again in the same thought, maybe they're not big, I don't know. So that had to change. We had to make sure that everyone really understood who you are and why you exist and what you did. In order to do that, we needed a big idea. And those are hard. Getting to a big idea is challenging, and getting a big idea across a finish line in a big organization is exponentially more difficult, right?
For sure, for sure. And so we had a lot of work to do. So with research in hand, tons and tons of research in hand, we really needed to make sure, though, that we aligned with our values of the organization. We really wanted to make sure that we were aligning with our leadership goals of where we were taking our organization. We wanted to make sure that we stayed true to our mission of inclusion and diversity. And we really wanted to make sure that whatever we did, whatever we came up with, really resonated and spoke to the needs of our community.
And we wanted to make sure that we could get it across the finish line, too. And one of the key tips to doing that is making sure the decision makers, the people who might shut an idea like this down, are involved from the very beginning, and involved deeply, not just asked, hey, is it okay if we rebrand the entire organization? We got to get them in there. And we did that. We had a series of board and leadership creative workshops, and they were a lot of fun. And they accomplished a lot, too.
Oh, my gosh, Craig, fun is just the beginning of it. You know what? We took these leaders out of their element, out of their offices. We put them in a conference room over and over at different phases along our journey to really bring them along. We had separate sessions with our leaders. We had separate sessions with our board members. But these weren't just sessions. These were interactive workshops with crayons and sketch pads, candies, animals, stuffed animals, flowers, paint chips, you name it. We played fun and games. We talked about word theory. We talked about the meaning of words. We had them go into grab bags and pull out words. You can see pictured here is our president and CEO, Dr. Janice Nevin, hard at work with crayons and words trying to put something together. She's seated right next to Dr. Ken Silverstein, our chief medical officer. So here they were rolling up their sleeves, actively drawing and thinking about colors that they thought of when they thought of the essence of ChristianaCare.
They were literally getting their hands dirty.
Oh, absolutely.
Which is fantastic. And these are drawings from the session. These are not some stock photo that we grabbed off Getty. These are people's drawings. And one of them in particular is going to add up to something more in just a minute. Will tell us about this bottom right-hand side?
Oh, my goodness. And I can't believe I never shared that with you. But
I just heard this story 2 days ago.
The bottom photo here is actually the sketch from Dr. Nevin. And so we collected all of these and we gave them to our partners at Wax, and they went to town with colors, with words, with symbols. With
we didn't know who had done anything.
No, we didn't tell you who had done anything.
A pile of things for inspiration. It was really great. And through all of this, some of the consumer research, and definitely through all these leadership and board workshops, a theme started to emerge. A word started to come up. And we've talked a lot about this word just in the past 2 days, right? And the word was love. It's not a word that organizations typically gravitate toward, although we talk about it a lot. To really make it the foundation of a brand is a pretty unusual thing. But this was the word that came up to the top and that really sparked the next round of ideas.
Yeah, and you know what, Craig? It came up just naturally and organically, because just a few years prior to this rebrand work, ChristianaCare had embarked on a long journey involving all caregivers again in a review of our values. And we came up with these very bold value and behavior statements. And we served together, guided by our values of love and excellence. And so this was already becoming a part of our culture, a part of who we were. This notion of love is very, very ingrained in our organization. It means different things to different people, but we've got 5 behaviors right here underneath love that tell you how we should act to one another as caregivers and how we should treat our patients. We've got 5 behaviors on the right side under excellence that kind of define who we are in terms of our excellence. So this isn't really just a poster on a wall. No, indeed. This is the culture at ChristianaCare. This is what we expect of folks, and this is what our patients can expect from us in return.
And it's part of your training from day one with new caregivers too, right?
Oh, absolutely.
Yeah, when they come in the door, they know this is what it is. And I mentioned a moment ago that good brands are authentic. You can pretend to be something, but people figure out pretty fast that that's not true. So your new brand is very authentic and very well aligned with work that you were actually doing before we even tried to figure out what the brand should be.
That's right.
So now our challenge was to create the visual and verbal elements that would let us show the love, literally, to the community and help them understand in a shorthanded way why ChristianaCare exists. There was still a lot of work to do, but we got through it and we got to it.
We did. Oh my goodness. Again, with our partners at Wax, I can't tell you how many times over and over. Look at this shape. Look at this color. Look at this word. How about a new name? We're like, oh. At this point, we had kind of decided with the board that we wanted to stick still with Christiana. It had such brand equity. We really couldn't come up with something new or different or a reason why to do so even. So we were like, we really wanted to do that. But what we came up with was this wonderful, wonderful logo, which is a variation of the peach blossom, which is the state flower for Delaware. And so it's a very unique peach blossom. We went with a really strong, bold color palette. We started with the green, but we brightened it up. It was just to give a nod to our legacy green from years and years ago. But we brightened it up, we brought in a blue, we brought in a gray to kind of add some masculinity to the colors that we have here. And the words ChristianaCare, guess what? We modernized the name. We brought that together, we took out the space between the two words, and we totally dropped the words healthcare system.
It seems like a small thing taking that space out between Christiana and Care, but it turned out to really be a big deal because it now perfectly aligns where you are and who you serve, Christiana, with what you do and why you exist, Care, ChristianaCare. There shouldn't be a space in there, and now there isn't. The other thing that we arrived at that we needed to do was come up with a theme line that could be used to introduce the new brand that would really help people get it instantly and connect with this brand. And the fact that all of these elements are very relatable to the audience helped a lot. And at the end of the day, we boiled the why, Christiana's why, down to this theme line. Why do we do the things that we do as providers? Why do you do the things that you do as caregivers? Why do you do the things that you do? And as individuals, why do we do the things we do? Well, we decided we do it all for the love of health. We're really excited with where this landed.
There's so much that could be said here, but this was the big ta-da! And so when we rolled it out to employees and it was spinning away and all those elements that you saw earlier were made into posters and we got those out to folks that they could understand kind of the background to why we came along. We really brought everybody along the journey so people could see and understand.
But first we wanted to create some suspense. Remember, this is a story and we were telling this story. And every good story includes a moment where you're not sure what's going to happen and what's going on. And you get, when I talk softer, you guys get softer, which seems weird, right? But there's a little bit of suspense in there and a little bit of intrigue. And we wanted to create that for this rebrand and this brand launch. We did that with a series of teaser messages. So for 2 weeks leading up to the launch of the new, beautiful new brand, we ran digital and traditional media all over the market like this. Now remember, nobody knew the peach blossom, nobody knew the colors, nobody really knew what was going on. We ran messages like this that just asked an intriguing question. Why eat fruits and vegetables? I don't know. People always tell me to, but I don't know why. There was no brand, no organization named, only this date, October the 3rd, 2019. Created kind of a stir, right?
It sure did. Internally and externally, we created this buzz. Now, internally with our caregivers, we started to run the same kind of teaser. So they were starting to catch on that, oh my goodness, what I'm seeing on the highway might be related to the organization I'm working in.
Adding up to something here, yeah.
It sure did.
And then on October the 3rd, it was revealed what that something was. This was a great day.
Oh my gosh. October 3rd, 2019 was our big reveal day. Man, with such great fanfare, we had a ball. We went to town. We launched it first with our leaders at the University of Delaware in their sporting arena. You could see we had banners falling from the ceiling We had all sorts of branded items and giveaways. We had a t-shirt cannon. We had confetti fall from the ceiling in our new branded colors. It was great excitement.
And then you took it to the street too with the rest of the team, with the rest of the ChristianaCare family. This guy wins like 5 t-shirts in a row here. This thing's on a loop and he just keeps winning t-shirt after t-shirt.
Oh my goodness. And I didn't see till just now up so close. He's got stickers all over his scrubs here with ChristianaCare. You name it, we branded it. We've got tissues, chapstick, lanyards, cups, stadium cups, t-shirts, hats. We had a wonderful October 3rd kicked off months-long activities of where we were going out and about on the streets. We had t-shirts, we had prizes, we had cookies in the shape of the new logo. They were delicious cookies. We had boxes that we took up to the floors because we recognized not everyone could get away from their work area. So we took those boxes that you saw in the other photo, filled with goodies, with granola bars. Everything was just branded ChristianaCare. Took it upstairs to the floors. We also had gifts for our patients as well. We also sent 14,000 pairs of socks.
I'm going to go full Steve Urkel on you because I wore my socks
all of our caregivers today. And our friends at Wax. Every single caregiver got a beautiful blue package filled with a pair of socks, a card magnet, a couple of other things, and a lovely note from our president and CEO, Dr.
This is incredible. Just like this guy here with all the swag, it turned 14,000 people into brand ambassadors because they were excited about it and they knew how to tell the story. That's really critical. Those people they are on the front line and they become your marketing department, basically. But we also wanted to take the story out to the public. And we did that in a big way. There was a press event. There was unveiling of signage on all of the facilities. Had these little branded cars zipping around all over the service area. There was a ton of excitement. We even had this giant bus, which was a lot of fun. I wanted to bring the bus and drive it out on stage at this point, but they wouldn't let me.
This indeed is our brand bus. Super, super proud of this. We took an old transit bus that was ready for retirement. I honestly just happened to call our facilities gentleman and say, hey, Bob, do we happen to have one of these buses?
Got any old buses laying around, Bob?
Oh my gosh. Actually, he called me back a week later. He's like, were you serious about that? I'm like, yeah, are you kidding me? So we had one. We shipped it away in the dark of night to York, Pennsylvania, to a place that really outfitted the bus. Totally took all the seats, everything out. We've got flooring in there. We've got a gaming system. We've got a selfie wall where children can come on the bus and actually put on. Smoothie bar.
I like the smoothie bar.
And the smoothie bar, there's a smoothie bar for fruit smoothies. So we are locked and loaded, man. We were all over the community there with this.
Then we snuck it back into town after dark too, right? And kind of hid it in the back of a parking garage.
We did. Nobody saw it.
And remember the teaser campaign? Well, almost overnight, we flipped out hundreds, maybe thousands of pieces of creative on all of the teaser campaign so that the answer to the questions was revealed. There were a series of questions. You saw the fruits and vegetables one. Why run the 5K? Well, the answer is simple. You do it for the love of health. And these messages also paid off with some version of what's at the bottom here, new look, same excellent care. So people could immediately make that connection and understand this isn't just wallpaper. This is really the representation of what ChristianaCare was yesterday, just now it looks like what it was yesterday too. Really fantastic. We flipped all of the outdoor. There were dozens of these boards up around all over town. And overnight, people drove down the highway and the answer was revealed. Well, what was that? Why eat more fruits and vegetables? For the love of health. It was everywhere. And we created this kind of
we sure did. We created a brand new TV spot. Super proud of this. We're going to show it to you. It starts with a beautiful image of the Delaware Memorial Bridge, which is a well-known landmark connecting Delaware and New Jersey together. Let's take a look.
Life is full of choices. Which doctor should I see? Should I go for that run today? Will I regret that second donut? Every healthy decision we make guides our well-being and shapes our future. Why do we strive to make the right decisions, even when they're the hard decisions? We do it for the love of health.
Still gives me chills when the blossom opens at the end. I really like that part. So we were rolling, right? It was October of 2019 into the spring of 2020. The new brand was everywhere. The steam line was everywhere. We were cooking. The launch was awesome.
Oh my gosh, we put the peach blossom on every single type of advertising that we were doing all throughout the community. New vibe, new feeling, new day for ChristianaCare.
It was like Oprah was giving blossoms to everybody. You get a blossom, and you get a blossom, and you get a blossom. Everybody gets a blossom.
That's right. Oh my gosh, and it popped all over our social media as well. Wonderful, wonderful, great image, stories, pictures, everything, all about our brand. We really did a good job trying to communicate and have people understand why we did what we did.
It looked great on the web. It looked great everywhere. And we had huge plans for it. Now remember, this was spring of 2020. Some of you might remember spring of 2020. Some of you probably had your own plans in the spring of 2020. Well, it turns out that beautiful brand bus was also a great mobile COVID testing center. And all of our plans for launching this incredible new brand really came to a screeching halt.
They really did. The only thing at that point that was really running was our brand bus up and down the state as we conducted COVID testing throughout the state. So what we had to do is stop hard stop with the rollout of the brand. It just wasn't the right time. But what we did very quickly with our partners, we pivoted and did everything about educating people about COVID and COVID safety and safety precautions. You name it, we were out there. It was really, really important that this bright, beautiful, brand new peach blossom stood for hope and trust. Trust us to give you the right information that we need right now in such uncertain times.
The white element in the middle of that blossom, you feel like represents hope. The
That's
white
right.
petals in there. So it was right on time, right? You really needed it to help get through this tricky, difficult
Oh my
time.
gosh, you name it, we did it. Our website totally turned over. All of our posters, English, Spanish, Mandarin too, everywhere we could, we put that blossom up there with really hopeful, helpful informations for our community. It didn't matter whether it was a blossom on an ad or the blossom on a new provider's lab coat. It just stood for a symbol of trust and hope and healing. And when it was time for the vaccines to roll out, guess what? Again, bright, beautiful images to get campaigns rolling to talk about the importance of vaccinations.
This particular campaign is targeted toward younger people who we immediately recognized were a lot less likely to get vaccinated than other populations, older people, people with chronic conditions who were at high risk. We wanted to help them understand why they might want to go and get vaccinated too, to protect the people around them. One of the tactics that we used, and this was brave of you to allow us to do this, is an influencer marketing campaign. We thought you might like to see a quick little look at the influencer marketing that we use. This is Dion. He's a D1 athlete at University of Delaware. He already had a great following amongst young men and some young women who really weren't exactly the audience we were trying to reach. So instead of a big health system telling them why they should get vaccinated, we worked with Dion. He made a nice little 3-part series of posts about his own decision to get vaccinated. And this is the third of those. Check it out.
What's up, guys? Welcome back to the video with your boy Dion. And in today's video, what I want to do is something totally different than I usually do. I'm going to be taking you guys along with me to get my second dose of the COVID vaccine. And I want to take you guys along the whole process so you guys can see it for yourself. And if they allow me, I'm going to actually try to take a video of me actually getting the vaccine. And yeah, it's kind of rainy and stormy out today, but no big deal. But we're going to head over there right now. Stay tuned. Let's get it. And as simple as that, I'm vaccinated, guys. Thanks for watching. Stay tuned for the next video.
This campaign got a great response, and Dion was a great spokesperson for this audience. I don't think it was because of Dion and the influencer marketing and the TikTok, but a particular older American showed up to be vaccinated at Christiana too.
You might have all seen this. We were super proud to host President Biden and his wife Jill at our Newark campus to get his vaccination and his double vaccine boost. So super, super proud about that. Even especially more excited that we were able to work with the White House staff to get in there before he got there to put our step and repeat up with our brand new brand. So we were super excited about that. You might have seen it, got national attention.
I had people calling me and saying, isn't ChristianaCare somebody you work with? I saw them on NBC News last night. Yeah, it's pretty great. Right. Eventually, we were, fortunately, kind of on the other side of COVID, and we recognized that a lot of people had delayed care. A lot of people had canceled appointments. They had done exactly what we told them to do, which was stay home, stay safe, don't go anywhere. But now they needed to go somewhere, right?
They did, and it was great. Again, this blossom stood for hope and healing, and it was time to engage and reconnect with care. Came out with a brand new campaign, Getting People Back, 3 easy ways to connect with us. We've got a video we'd love to show.
Healthy habits have always started at home, but now everyday actions are life-saving practices, and we're all taking extra steps to stay strong, both physically and emotionally. You've done the right things to safeguard your loved ones and the community, but what about yourself? It's your turn. Choose one of 3 convenient ways to speak with your ChristianaCare provider, because sometimes to care for others, you need to be cared for first. We're here for you, for the love of health.
And remember, I said a few minutes ago that good brands facilitate conversations and are kind of the foundation. A good brand story gives you a foundation to build stories on and really to speak to people clearly from. We're using this brand in a lot of powerful ways to bring people back for care and to get them what they need. This is a primary care campaign that's running right now, omni-channel, direct mail pieces, digital, some super targeted geofencing plays. We're also using it to welcome people to the neighborhood with a new mover program. They don't have any brand affiliation. They don't know anything about anything when they show up in Delaware, but they do need a primary care provider and probably a pediatrician too. So the brand story is a beautiful, easy one to tell them, and they're reacting really well. They get it. We also use the fresh new brand to make sure people get screenings that they need and make sure that they take the risk assessments that they need and really to get them in for specialized care. This is about bariatric surgery, but you can see how it can work for lots of applications. And finally, a strong brand story is great for internal audiences. It's a really competitive market right now. I'm sure you guys all know, especially for nurses, but for employees in general in the world of health and wellness. People like to affiliate themselves with a place that they can feel good about, that they can be proud to work for. And having a clear and compelling brand story like this one makes it a lot easier to attract the new people and a lot more likely that the current people are going to stick around. This has been a very successful part of the rollout. Okay, so I said we were going to chart a course and it was going to end sort of with research and figuring out how we did. How did we do?
That's right. You know, we are super proud of the results. And while we didn't exactly follow the path we thought we were going to, that months and months long of rollout got scrapped and we filled it in with other good things relative to COVID. We were super proud of the results. We did a benchmark survey, a brand strength study in 2019 prior to our rebrand. So we had a base of where we were. Super excited to share that in 2021, when we did that same survey again, we had tremendous increase in brand awareness, brand consideration, and hospital preference. And remember when we were told that people didn't know our services, people weren't aware of us? Well, guess what? Look at those blue lines now in 2021 compared to where we were in terms of our services from 2019. So again, we were super thrilled with the results that we found, all because of the great brand work that we had done.
Yeah, they know who you are now, and they understand why they would want to choose you, and they also know more tactically what you do and how you can help them live healthier lives. So that was the research that we did to see how we were doing, and you're going to do that again, right? Every couple of years, the plan is to keep doing that, and you should do that too in your organizations. Make sure that you have a plan for tracking and evolving, and really, we've evolved your brand somewhat just over the past year. We've added in certain situations, we've added the word your into the theme line. So now on some of the radio and TV spots, it says, why? For the love of health, your health, which really personalizes it and brings it down. So you should always be evolving, but following the rules too. We were really excited about some other research that happened that we had nothing to do with, right? But when we got the results, we excitedly got on some phone calls.
we were so excited. A study done by Monocle and the American Hospital Association called ChristianaCare the most improved healthcare brand in the nation. Super, super proud of that accomplishment, where we rose from the position of 157 to number 43. And again, I know it's all because of the great brand work we did, the research. Thank you. That's very sweet.
Thank you.
The research, the work, the love, and the excellence that went into this, honestly.
And it isn't just that. On these 4 different criteria, you also outperformed all the competition and national averages on these emotional components. So it's a real testament to the brand that you've built that people feel like they can connect with. So what's next?
Well, the future's bright for ChristianaCare, brighter than we could have ever imagined. And thanks to this new brand, it's really become a symbol of hope, of trust, of healing. And I would be remiss if I didn't say that organically early on, when we came out with the Blossom, COVID was horrible. People were dying. It was such uncertain times. Our teams themselves came up with the notion of Code Blossom. We all know we have codes in our healthcare system. They came up with this word themselves, and it was a time to gather together to celebrate the walkway to recovery as we escorted patients who had recovered from COVID out. It was just something very organic and naturally that caregivers came up themselves. Super proud of that, still touched. And so the future is bright for ChristianaCare. We are growing again in different ways. We've got a hospital care at home program where we're delivering a new model of care, hospital level care to people in their home. We just purchased an old hospital in Pennsylvania, just over the state line. We're looking forward to expanding that. We're starting with a bunch of research with the community to really get an assessment of the needs of the community. And we're opening a new pediatric care center on our Newark campus there that'll have 24/7 care for children in our community starting this fall.
Lots of excitement, lots of great things going on. We want to leave you guys with just a few things to think about when you decide it's time to show your brand some love.
Definitely. First and foremost, listen. You've heard that from many speakers here this weekend. Listen to your audience. Really, really dig deep. See what they have to say. Listen, be open to anything. We were open to anything. We just didn't know where the research was going to take us.
Wherever it takes you, make sure that it's real and that it's authentic. Otherwise, people will see right through it immediately. So create a brand that's meaningful and that's aligned with what your organization really stands for. Find your why, and then you have to go omni-channel. And this is not just some ad agency guy telling you to spend a lot of money on media. The only way to really do a rebrand correctly is to get it everywhere. And that doesn't just mean advertising. It means in the facilities, all the lab coats, the new brand has to go everywhere so that everybody feels the power of it. And then take that excitement outside the walls of the hospital too, and create some excitement and some intrigue and get the whole community involved. And then you can be as successful as this beautiful new ChristianaCare brand is. Thank you for your attention today. I promised you that there was a happy end, and here it is, a bunch of hearts, so you know that it's about love.
Thank you very much.